Whether it's an emergency or you're looking for long-term care for your heart health, there are two hospitals you want to look into: Chandler Regional and Mercy Gilbert Medical Centers. This is Dr. Roger Bies, and you are an interventional cardiologist.
Correct.
You founded a program here that is so amazing. I'm learning so much about it. It's called the Heart Health Organization, or H2O. Now, what does H2O mean?
H2O is a group of 30 physicians from 14 different practices. We have a pretty big footprint around Mesa, Tempe, Gilbert, Chandler, Casa Grande, and we're designed to basically provide a high level of quality service, but do it efficiently, cost effectively, with a high level of patient satisfaction. And it's an organization that's sort of new and innovative that most facilities don't have.
Right. Now, I know, what's 24/7? What does that mean to me as a patient or in an emergency?
Well, at these two facilities, and what's unique in the state of Arizona is we actually have an on-site cardiologist who's available between 7 a.m. and 9 p.m. on call 24/7, but he's physically present. So if you come in, you're going to see him within 5 or 10 minutes.
Wow. You're
not waiting until the next day or whatever to see a specialist. So you're going to get care up front, and you're going to get quality care right away.
And that is so important when time is of the essence. But it's also innovation. I mean, you have a lot of technology here too.
We do. You know, not only is the technology high tech, but we also have a very high quality system. We're beating the national average on most of the things like complication rates or patients coming back to the hospital or having too many procedures done. But one of our technologies is the 3D heart scan, it's called, but it gives you the ability, if you come into the hospital with chest pain, to have your heart looked at. And within 6 hours, we know whether you need to come into the hospital or whether you can safely go home. And we've actually been able to cut down unnecessary hospital admissions by 75% by using the 3D technology in the emergency department.
Wow, that's so amazing. I can't even believe that technology exists. And as the patient, that means that you're diagnosed properly from the get-go.
Right.
And if you do have a heart condition, you're able to treat it right away. Or if it's something else, you know that right then.
Right. Yeah, you're not taking the risk of sending someone home, and you're also not putting them through an unnecessary invasive heart cath procedure when all they need is a scan that can be done safely with an IV, and the patient knows securely that they're not having a heart condition.
Let's talk about the website quickly, because for people at home who are thinking, you know, I'm looking for a doctor, I'm looking for a facility, or maybe just want to be prepared, going to the website, they can actually get some of the basic questions answered by you and learn more about you and all of the doctors part of the program, who are part of the program.
Exactly. There's physician profiles for all the doctors, contact information if there's someone you want to see in your area. There's all the quality metrics that compare our outcomes to those on the national stage. And there's, of course, information. So we do write articles. There's a lot of information from Ask the Expert columns that have been done in the newspaper about different types of heart conditions, as well as new research trials for stem cells and things that might not be available elsewhere in the state.
Bottom line is, you don't want to end up in this room.
If you can avoid it. You'd like to get you know, good medical treatment and not end up here.
Yeah,
right.
You don't want to end up in this room right here. You want to get treated and get out the door. And for more information about Dignity Health and their website, it's Heart Health Organization H2O. You can visit that website at hearthealthaz.org.